New research upends conventional wisdom about marriage and dementia risk. For decades, medical professionals have operated under the assumption that marriage serves as a protective factor against cognitive decline and dementia. This belief has shaped countless recommendations and influenced how we think about social relationships in the context of brain health. Healthcare providers have routinely counseled patients about the importance of maintaining strong marital bonds as part of comprehensive strategies for healthy aging. However, groundbreaking research has emerged that fundamentally challenges this long-standing assumption, suggesting that unmarried individuals might actually face a lower risk of developing dementia compared to their married counterparts. The comprehensive study, which appeared in the prestigious Alzheimer's and Dementia Journal, drew upon extensive data from the National Alzheimer's Coordinating Center. Researchers analyzed information from approximately 24,000 adults who underwent yearly clinical evaluations for dementia over a period extending up to 18 years. This remarkable scope and duration provide unprecedented insights into the relationship between marital status and cognitive health outcomes. The sheer scale of this investigation sets it apart from previous research, offering statistical power and longitudinal depth that few earlier studies could match. The methodology employed by researchers involved sophisticated statistical analyses that accounted for numerous potential confounding variables. Participants received comprehensive cognitive assessments annually, allowing researchers to track subtle changes in mental function over time. These evaluations included standardized tests of memory, executive function, language abilities, and other cognitive domains affected by dementia. The rigorous nature of these assessments ensures that the findings reflect genuine differences in cognitive outcomes rather than measurement artifacts or diagnostic inconsistencies. What makes these findings particularly striking is how they contradict the established body of research. The scientific community has long documented the cognitive benefits of marriage, with numerous studies suggesting that married individuals enjoy better brain health outcomes as they age. Meta-analyses published over the past 2 decades consistently showed married people experiencing lower rates of cognitive decline and dementia diagnosis. The researchers themselves acknowledged this contradiction, noting that their results stand in opposition to most previous longitudinal research, which consistently reported lower rates of cognitive impairment and dementia among married populations compared to those who were single, divorced, or widowed. The study revealed that individuals who had never married, as well as those who were divorced or had lost their spouses, demonstrated a reduced likelihood of developing dementia when compared to currently married participants. This unexpected pattern has prompted researchers and clinicians to reconsider their understanding of how relationship status influences cognitive health trajectories. The magnitude of this effect proved substantial enough to remain statistically significant even after controlling for factors such as age, education, socioeconomic status, and baseline health conditions. To explain these surprising results, researchers have proposed several mechanisms through which being unmarried might confer cognitive benefits. One key hypothesis centers on social engagement patterns. Evidence suggests that single and divorced individuals often maintain broader social networks and engage more actively with their communities. This enhanced social integration could serve as a protective mechanism against cognitive decline over time. Unmarried individuals may cultivate diverse friendships, participate in various social groups, and maintain connections across multiple contexts, creating rich networks of cognitive stimulation and emotional support. The concept of social portfolio diversification offers another lens through which to understand these findings. Just as financial advisors recommend diversifying investment portfolios to minimize risk, unmarried individuals may naturally diversify their social portfolios. Rather than relying primarily on one relationship for emotional support and social interaction, they develop multiple meaningful connections. This diversification might provide resilience against the cognitive impacts of losing any single relationship and ensure continued social stimulation from various sources. Conversely, married individuals sometimes experience reduced social connections outside their primary relationship, potentially limiting the cognitive stimulation that comes from diverse social interactions. The phenomenon of social network shrinkage following marriage has been documented across cultures and demographics. Newly married couples often reduce contact with friends and extended family, focusing their social energy on their partnership. While this consolidation might strengthen the marital bond, it could inadvertently reduce the variety of social experiences that challenge and maintain cognitive function. The quality of marital relationships emerges as a crucial factor in understanding these findings. The research team emphasized that substantial evidence indicates marriage only provides health benefits when the relationship is of high quality. They pointed out that individuals experiencing marital dissatisfaction often face health outcomes equal to or worse than those of their unmarried peers. This nuanced view suggests that the simple binary of married versus unmarried fails to capture the complexity of how relationships impact health. Chronic marital stress represents a significant risk factor for numerous health conditions, including those affecting cognitive function. The physiological impacts of living in an unhappy marriage include elevated cortisol levels, chronic inflammation, and disrupted sleep patterns, all of which have been linked to increased dementia risk. The cumulative effect of years or decades of marital discord could potentially outweigh any protective benefits that marriage might otherwise confer. She emphasized how this research disrupts the traditional narrative about marriage serving as a dementia prevention strategy. The protective effects of marriage appear limited to relationships characterized by happiness and mutual support. Her clinical experience corroborates the research findings, as she has observed how relationship quality profoundly influences cognitive health trajectories among her patients. The implications extend beyond individual relationships to broader questions about social connection and cognitive health. Research consistently demonstrates that individuals in unhappy marriages face elevated risks for various negative health outcomes. This suggests that relationship quality, rather than relationship status itself, plays the determining role in how partnerships influence dementia risk. The stress of maintaining an unsatisfying marriage might actually accelerate cognitive decline through multiple pathways, including psychological distress, poor health behaviors, and reduced engagement in cognitively stimulating activities. There is a mixed nature of research examining marriage and dementia risk. We should caution against drawing overly broad conclusions from any single study. The relationship between marital status and cognitive outcomes likely involves numerous variables that researchers are still working to understand fully. Cultural factors, gender differences, socioeconomic considerations, and cohort effects all potentially influence how marriage impacts cognitive health. Making definitive statements about whether marriage increases or decreases dementia risk may be premature given the current state of scientific knowledge. The historical context of marriage and health research reveals how societal changes might influence these relationships. Earlier studies showing protective effects of marriage often examined cohorts who married in different social contexts, when gender roles, divorce rates, and social expectations differed significantly from today. Contemporary marriages exist within transformed social landscapes where both partners often maintain careers, friendships, and independent interests. These changes might alter how marriage influences health outcomes, including cognitive function. Perhaps the most significant insight from this research concerns the fundamental importance of social connection for cognitive health. Meaningful social relationships benefit brain health regardless of whether they occur within or outside the context of marriage. This perspective shifts the focus from relationship status to relationship quality and social engagement more broadly. The human brain evolved within social contexts, and maintaining rich social connections throughout life appears essential for preserving cognitive function. The neurobiological mechanisms linking social connection to cognitive health continue to emerge through research. Social interaction stimulates multiple brain regions, promotes neuroplasticity, and may enhance cognitive reserve. Engaging conversations challenge working memory, attention, and executive function. Emotional connections activate reward systems and promote the release of neuroprotective factors. These benefits occur whether social connections arise through marriage, friendship, community involvement, or family relationships. The study's findings invite us to reconsider how we conceptualize protective factors against dementia. Rather than viewing marriage as inherently beneficial or harmful to cognitive health, we might better understand it as one of many potential contexts for social connection. The quality of our relationships and the breadth of our social engagement appear to matter far more than our official relationship status. This reframing opens possibilities for promoting cognitive health across diverse life circumstances and relationship configurations. These insights have practical implications for how individuals approach their social lives with cognitive health in mind. For married individuals, the research underscores the importance of maintaining relationship quality and avoiding social isolation within marriage. Couples might benefit from consciously cultivating friendships outside their partnership, engaging in separate activities that provide diverse social experiences, and addressing relationship difficulties before they become chronic stressors. The goal involves creating marriages that enhance rather than restrict social connection. For unmarried individuals, the findings offer reassurance that their lifestyle choices need not compromise their cognitive health prospects, provided they maintain meaningful social connections. Single adults might focus on building and maintaining diverse social networks, participating in community activities, and creating chosen families of close friends. The absence of a marital partner need not mean social isolation or increased dementia risk when other relationships provide connection and support. The research also raises important questions for healthcare providers and policymakers. If social connection rather than marital status determines cognitive health outcomes, interventions should focus on fostering meaningful relationships and community engagement regardless of individuals' partnership status. This might involve creating more opportunities for social interaction among older adults, supporting community programs that bring people together, and recognizing the diverse forms that protective social relationships can take. Healthcare systems might need to expand their definition of family and support systems when caring for older adults. Rather than assuming married patients have adequate social support or that unmarried patients lack it, providers could assess the quality and extent of each individual's social connections. Interventions to prevent cognitive decline might focus less on relationship status and more on helping patients cultivate meaningful connections in whatever form suits their life circumstances. Community-level interventions could address social isolation without privileging any particular relationship structure. Senior centers, interest-based clubs, volunteer organizations, and intergenerational programs all provide venues for meaningful social connection. Urban planning that promotes walkable neighborhoods and gathering spaces can facilitate spontaneous social interactions. Technology platforms designed for older adults might help maintain long-distance relationships and forge new connections based on shared interests. The implications extend to how we design living environments for older adults. Rather than segregating individuals based on marital status or assuming couples always want to live together, communities might offer flexible arrangements that support various relationship configurations while promoting social interaction. Co-housing initiatives, shared interest communities, and innovative residential designs could support cognitive health by facilitating connection while respecting individual preferences. As our understanding of dementia risk factors continues to evolve, this research represents an important step toward more nuanced and accurate models of cognitive health. By moving beyond simplistic assumptions about marriage and recognizing the complex ways that relationships influence brain health, we can develop more effective strategies for dementia prevention that work for people across all relationship statuses. The findings challenge us to think more creatively about supporting cognitive health throughout the lifespan. The study serves as a reminder that scientific understanding constantly evolves, and we must remain open to evidence that challenges our assumptions. What matters most for cognitive health appears to be not whether we are married or single, but whether we maintain rich, meaningful connections with others throughout our lives. This more inclusive understanding of protective factors offers hope and guidance for everyone concerned about maintaining cognitive health as they age, regardless of their relationship status or life circumstances. Future research directions might explore how different types of social relationships contribute to cognitive health, examining the specific qualities that make connections protective. Investigators could study how relationship transitions, such as divorce or widowhood, influence cognitive trajectories and what factors promote resilience during these changes. Cross-cultural studies might reveal how societal contexts shape the relationship between marriage and cognitive health, providing insights applicable across diverse populations. The conversation about marriage and cognitive health ultimately reflects broader questions about how we create societies that support human flourishing across the lifespan. Rather than prescribing universal relationship solutions, we might focus on ensuring all individuals have opportunities for meaningful connection, regardless of their marital status. This approach recognizes the diversity of human relationships while maintaining focus on what research increasingly shows matters most: the quality of our connections with others. As we integrate these findings into public health approaches and individual health decisions, we must avoid replacing one oversimplification with another. The goal is not to discourage marriage or promote remaining single, but rather to understand the complex factors that truly support cognitive health. By doing so, we can provide better guidance to individuals making life choices and create supportive environments that promote brain health for all members of society, regardless of their relationship status or personal circumstances.